Acne scars are easily recognized by the red skin of an area formerly occupied by a pimple. The initial form, while not actually a scar, will lead to one in some cases. Unfortunately, the only way to know for sure that it is a scar is if the red skin persists for longer than 6 to 12 months. It is often better, therefore, to treat all acne lesions as potential scars. What causes acne scars? Acne scars are caused by an overabundance of the connective tissues your body uses to heal itself. These tissues work to provide a temporary framework for your skin cells to regrow on. But if there is too much of this connective tissue, it is not broken down when the healing is complete, but rather stays permanently. This causes a discolored or unpigmented section of skin to form. Avoiding acne scars. Since the root cause of acne scarring is acne, preventing acne in the first place is the best way to avoid scars. But even if you already have acne, it is still possible to prevent acne scars from forming. The way this is done is by speeding the healing process as much as possible. The faster your acne lesion heals, the less time the connective tissue framework has to overgrow and leave scars. Speeding the healing process. There are two main treatments dermatologists use to facilitate the rapid healing of acne lesions. The first is tretinoin, an acid derivative of vitamin A, also known as all-trans retinoic acid. This chemical speeds the skin's healing, reducing inflammation and preventing acne scars from forming. The second method involves the use of various alpha and beta hydroxy acids, which perform much the same function as tretinoin, speeding healing, and reducing the chance of scarring. Helping yourself. Even if you don't or can't see a dermatologist, there are several different things you can do yourself that can help prevent acne scars from forming. The biggest thing is to treat your skin well. Avoid overexposure to the sun, as sunburns can dramatically slow the healing process. Always wear sunscreen when going out in the sun. Don't pop your pimples, and if there are scabs from lesions, do not pick at them. Picking at any wound as it heals causes more damage, extending healing times, and increasing the likelihood of scar tissue forming. Removing existing acne scars. Even with the best of care, scarring still sometimes occurs. But even if a scar does form, there are several options available that can reduce or eliminate your visible scarring. Dermal fillers. Fillers such as collagen can be injected into the site of an acne scar, raising the skin surface to reduce the appearance of pockmarks. These are not permanent treatments, however, and will require re-injection every 3 to 6 months. Laser resurfacing. An extremely popular and fast treatment for acne scars. Laser resurfacing works by burning a precisely measured upper layer of skin. New skin then grows over the wound, leaving mostly unscarred skin visible. But as with the initial acne healing process, care must be taken to ensure that this new skin does not scar as well. Punch excision. This procedure is only effective on certain types of scars. A surgical punch is made to precisely the dimensions of the scar to be removed. The scar is then punched out, similar to a cookie cutter, and the wound is sewn together. If there is any scarring left after the wound heals, it can be more easily treated with laser resurfacing than the original larger scar. Acne skin care products. Keeping your skin healthy and acne-free takes some time, effort, and of course the proper acne skincare products. However, nearly everyone gets a pimple at some point in their lives. While teenagers are of course more prone to acne than adults, all age groups can benefit from the proper use of acne skincare products. Things to keep in mind. The biggest thing to keep in mind when shopping around for acne skincare products right for you is that everyone's skin reacts differently to various products. There are many different kinds of acne skincare products to choose from with widely different ingredients and formulas. If you have acne-prone skin, your skin will probably tend to be more sensitive to the various chemicals you may wind up using. You should take it easy when trying out various acne skincare products. Check for a bad reaction before you cover your entire face. Remember, what works for others may not work for you. The only way to find out for sure if it will work for you is to try an acne skincare product and see for yourself. Facial cleansers. Probably the most often used acne skincare products are various facial cleansers. Try and find one that is gentle to your skin, and matched to your skin type. Oily skin needs different care than dry skin, for example. It is important to use a different kind of soap for your face than your body. Most body soaps tend to be too harsh for use on your face, especially if you have active acne. But whatever you choose to use, stay with it. Changing to different chemicals or formulas, especially after using one specific brand of acne skincare product for a while, can cause more harm than good. And be careful of skin toners. They can dry your skin out, making you more prone to acne. If you use a toner, you should also consider using a moisturizer. Moisturizers. If you are using any acne skincare products with benzoyl peroxide, you should consider using a moisturizer, since it tends to dry your skin. Most wipes and some facial cleansers contain ingredients such as salicylic acid that can also dry your skin, so you should use a moisturizer as well. Razors. Regardless of whether you use a bladed razor or an electric of some type, you must be very careful to avoid damaging your skin, especially if you have active acne. Keep the blades clean, and avoid cutting any blemishes you may have. The bacteria that cause acne can easily infect any razor nicks. The use of shaving cream can help prevent further irritating the skin. Whichever type of razor you use, you must be careful to avoid spreading or worsening your skin condition. Healthy inside, healthy out. Since acne is a bacterial infection, anything that boosts the body's ability to fight off infection can help keep your acne free and reduce the healing time of any acne you may have already. Taking a good multivitamin rich in vitamins A and C helps your immune system, while vitamins B6 and E, for example, are good for your skin. Foods with lots of sulfur such as garlic and onions can help speed the recovery time of any acne you may have. Final thoughts. With such a bewildering array of acne skincare products out there, it may save you time and effort to go see a dermatologist. They can make recommendations based on their experience and point you towards the products that are right for you. They can also give you advice on the proper use of any products they may recommend. Dealing with teen acne. Acne is a major problem for those who have it. Not only are there major physical changes, but psychological changes as well. Formerly confident teens may find their self-confidence shaken by the way they look now. Social problems. Normal social situations often become awkward and difficult for a teen suffering from acne to face. They will often try to avoid these social situations as much as possible. The teen may feel self-conscious and cut off from the group. There is a stigma associated with acne, and amongst teens especially, it is often considered to be a sign that a person is dirty or doesn't take care of themselves. All of this can make even going to class a painful experience for a teen. It erodes the teen's self-confidence, and sometimes these feelings will follow the teen into adulthood and cause depression and social maladjustment. A lack of understanding. Many people who are not suffering from acne just don't seem to understand what the teen may be going through. They may think that the teen is just overreacting and that it's not that bad. But in recent years, the social and psychological side effect has been studied more closely. They found that acne is as much about how you think you look and how you feel emotionally, as it is the actual physical appearance. A teen's self-image and self-confidence can be fragile things while they are growing up, and having acne can cause the teen to have to deal with all sorts of unwelcome pressures and prejudices. Modern society places a lot of emphasis on appearances, and anything outside the norm brings pressure to bear on the person breaking the norm. When asked how they felt during these studies, teens with acne often said that they felt ugly and depressed. These feelings can persist into adulthood and are not gender-specific. Both males and females felt similarly about their acne and how it made them feel. Understanding what's happening. Understanding what pressures and feelings having acne can place upon your teen is very important, especially during the earlier teenage years. You must understand that acne is a big deal, and can leave lasting scars emotionally as well as physically. If you notice a change in your teen's behaviors, such as suddenly losing interest in social occasions, drop in grades, moodiness, etc., ask them what is bothering them. If it turns out that it is acne, don't just shrug it off. Take them to see a dermatologist, especially in the more severe cases. Make sure they understand that nothing they did is the cause of their acne and that it will get better if they take care of it properly. Then make sure that they do take care of it properly.